This is Dr. Chen speaking for your teen assignment this week in Wiki. Week 6 Wiki is graded for participation point. So make sure each of you participates with good attempts and contributes to the table contents as much as you can. But I'm not going to evaluate contents, whether it is correct or incorrect. Also, as many students experience problems of posting in Blackboard Wiki content area, I would encourage you always save your own work in Word as backup, and you could post it in the comment area so your other team members are able to post it for you with your name in the content area for grading purpose. As far as my understanding, our College of Nursing instructional designer and university system administrator has reported this issue to Blackboard company, and now we are waiting for their response, as this issue only occurs in partial students and it usually comes and goes, so it may take a while to solve it, and hope this issue could be solved shortly, and I will keep you posted once I hear back from Rachel, the instructional designer. Thank you for your patience and time. This week, Wiki is to continue your work from Wiki 3 and complete Table 1 and draft Table 2. You will have plenty of time to finalize Table 2 or slightly modify Table 1, as we will extend another week in Week 7 to continue working on the Table 2. In Week 3, we conducted literature search, and each of you selected at least one article according to your topic of interest. For this week assignment, we only focus on quantitative research articles. So, if your article did not use quantitative approach, then you would need to redo the search and get an appropriate one for this week wiki table. This time your article is qualified with any type of quantitative methods. We only want quantitative research articles for this week wiki, including mixed methods and or quantitative meta-analysis, and not acceptable in single qualitative approach. Meta-synthesis, systematic review, or case study. Each group needs to work together and discuss and evaluate other team members' articles to make sure the qualitative methods used in the article being selected and level of evidence. For learning purpose, I would like to see variations on level of evidence for this assignment, and make sure to limit the article published years as well. Other required criteria, please see the weekly direction. Once the article is ensured its appropriateness, each of you read the article you selected and identify the information using the rapid critical appraisal criteria or any other critiquing criteria that were provided to you as your references in the previous weeks. I personally encourage you to take some time to review those criteria and apply to the summary table contents for this week, because the more you review and use, the greater understanding of the appraisal knowledge and skills you will learn. For completing the table boxes, if you are not sure your information is correct, please work with your team members more closely to review, discuss, revise, and finalize it. This Table 1 template is also provided in your weekly direction with 5 must have columns for you to start the table. Information in each box must be briefly described and addressed using bullet points, and do not use a paragraph. The first column, study citation, includes author's name and published year. I also add country for each group to better understand where the evidence you pull up from. Here are the examples for you while the article has two or more authors. No need for first name initial. The column of study design needs to be specific, such as prospective, retrospective, correlational, predictive, pre and post comparison study, or randomized clinical trial study, etc. We will learn more study design methods in next 3 weeks as well. Sample setting includes sample size and settings. I also have an example here for you. 35 cancer patients. 35 is a sample size. So we point out size and sample characteristics. Cancer patients. If you know they are liver cancers or lung cancer patients during chemotherapy or post-surgery from outpatients of 3 teaching hospitals or from 3 different countries. And you also want to mention if this is an intervention experimental study design, then you might want to say this is the group 1 or group A is 20 intervention patients, and then group B is control or routine care patient group. Research question. List all research questions from the articles and then compare with your researchable question. You could modify your group question at this time and make it the final as the reformed question. After this week, no more revision of the question is expected, if possible. Other than the must-have 5 columns listed in the table 1 here, each group is allowed and encouraged to add more columns in the table as necessary. I pull out 3 tables for you as an example from the instructions for literature summary tables under group project resources. You can use or modify the column category from each of the 3 tables. For table 2, for example, research question, variables, instruments, and outcomes are must-have items. You can combine variable and instrument into one column if you want to, and you can see the example in the slide for your information. So using the table 1 template, your group could decide to add more columns or combine table 1 and 2 with or must-have and appropriate columns. It's all your call to make the decision following the table instructions provided to you. This is one of the sample posters that you should have seen from the group project resources. The table 1 in this sample poster shows the combination of table 1 and 2 for your information. The table 2 in this poster is also recommended if applicable for your topic of interest. By the way, the table 3 is not represented by a table, but a summary list addressed on the left side of the poster, titled, for example, Strengths and Gap of Research Findings. And I also want to emphasize this is only the sample poster, so you do not have to only use this sample poster. You can also look at other sample posters for your example for your future group project. I hope this audio would ease some of your steps of doing this week wiki and hope it is helpful. If you have any other question, feel free to post in course Q&A, call me, talk to me, or send it through course mail to my attention. Thank you.